Sleep apnea is something that's just come into our lives in the last few years with Owen. Some of the issues, with sleep apnea is snoring. Some of the other things are fatigue and, difficulty concentrating during the day and so forth. And we tried to research a few things to see what we could do for him, and he ended up going to an apnea care facility and, trying to see what pathway they had for him there.
I had an overnight down at Millard Fillmore where they observed me and then showed me some results, testing results, fitted me for a machine, and then I went back and had another follow-up test with the machine apparatus attached, and it went fairly well. It just became uncomfortable over time and somewhat intrusive to have this machine part of my sleeping process every night. Scott mentioned that he had a specific apparatus that he might be able to fit to my jaw or fit to my teeth.
For the people with mild to moderate sleep apnea, we make an oral appliance that allows the jaw to reposition a little bit and open the airway. What's important is it allows some people a substitute for their CPAP machine in a much more comfortable, much more portable, much more acceptable modality. You can imagine popping in a little mouthpiece and sleeping with that as opposed to strapping on a scuba mask to try to go to sleep that's attached to a machine on your lampstand. Right? Well, the reaction from these has been fantastic. I've got a call, I can remember the very first group of patients we took care of, the wives of the patients called me the next day and said, "Oh my gosh, thank you. I can sleep in the same room with this guy now." And that's just the snoring, that's the noisy part. But from a health standpoint, when people understand the impact that apnea has on you and addressing that, how very important that is for cardiovascular health, for staying awake when you're driving, work performance, and general mood alteration. Sleep apnea, the awareness and the growth of that whole area is very important that people get on board with.
So I think it's really the right thing for him, much less obtrusive, like you said. That huge mask on his face was just ridiculous.
It's fairly straightforward and simple, and I think that Scott will have many more positive returns from this process as he starts to do this with more and more patients.